Clean needles save lives. Why should we consider giving drug addicts clean needles? When drug addicts are using needles and syringes to inject drugs, if sharing the needles or not using clean or sterile equipment, there's a high chance that they will pick up or spread a blood-borne illness. I wanted to do this topic because I think the medical field is very interesting. This is also a current issue that is going on right now with heroin being on the rise. It is important that we know how to keep these people safe. Some of the things I will talk about include what kinds of blood-borne illnesses that can be prevented, how needle exchanges work, and the cost efficiency that comes with giving clean needles. Let's begin with the diseases that can be transmitted. There are 3 blood-borne illnesses that can be transmitted or passed on from sharing needles. The first one is HIV. To get HIV in the first place from sharing needles, you would have to use a dirty needle from somebody who has HIV. However, it is not easy to tell if somebody has HIV. Out of all the people who are annually diagnosed with HIV, 10% got it from sharing needles. The second one is hepatitis B. Hepatitis B is the leading cause of liver cancer and is the most common reason to have a liver transplant. Sometimes symptoms don't show up for weeks, even years, so it's hard to tell if somebody has this blood-borne illness. And if you use the same needle, you can get hepatitis B. The last one is hepatitis C. Out of all the injection drug users who have HIV, around 80% of them are also infected with hepatitis C, which is also known as HCV. There are 2 types of HCV: acute, which is short-term, and chronic, which is long-term. Most people who have acute hepatitis C end up with chronic hepatitis C. So what exactly is a needle exchange? Basically, a needle exchange is when you take your used needle and they give you a clean one. This also prevents the used needles from lying around outside, or even if it's disposed of in a trash can, it can still poke someone, like a sanitation worker. And if the drug addict who used it has one of these 3 blood-borne illnesses, there is a chance that they will now have that disease too. Also, if they're lying around, they have the potential to be picked up and reused by somebody else. Drug addicts are going to use whatever they can to achieve that high. By doing needle exchanges, we are keeping them off the streets and giving them sterile needles to help prevent diseases. Each year, more and more people are using these exchanges to get clean supplies. These exchanges don't just hand out clean needles. They also give people information about how to stop drug use. They also provide STD testing to find out if they have one or not. Drug addicts might start to go just for the new needles, but many do try and stop and continue to receive medical help. Now that we have talked about needle and syringe exchange, now let's consider cost efficiency. How does giving free needles reduce costs for drug addicts? It reduces the cost by preventing diseases which can be very expensive to treat. The cost to treat someone with HIV for the rest of their lives can be from $385,200 and $618,900, compared to a 15-cent or even free sterile needle. Hepatitis B and C can be anywhere from $25,000 to $30,000 a year for treatment. It roughly costs $1,600 to run a needle exchange program, which is $20 per user per year. An HIV patient is upwards of $120,000 per year in public health expenditures. This is the bar graph that I made of the NEP and the HIV. This is the needle exchange program. It's only $20 for the needle exchange program per year, and then for the HIV, you have it all the way up there for $120,000 per year. As you can see, it is more cost efficient to be giving out clean needles. Overall, we should be helping out drug addicts by giving them clean needles. So to recap, there are 3 blood-borne diseases that come with sharing and reusing dirty needles: HIV, hepatitis B, and hepatitis C. We then learned how needle exchanges work and how they benefit drug addicts, and then we saw the cost efficiency that comes with clean needles. These are the reasons why we should be giving addicts free clean needles to use. Thank you.